Greetings, friends. Namaskar. Welcome to third Canada-India Healthcare Summit, organized by Canada-India Foundation, Consulate General of India in Toronto, FICCI, and University Health Network Toronto, representing civil society, government, industry, trade and commerce, and university researchers and academics. It gives us great pleasure to bring you in for this Canada-India Healthcare Summit. The discussion started about 18 months back with Consulate General of India, Srimati Apurvaji, and ourselves, looking at continuing our earlier healthcare summits. What can we be doing different to avail ourselves of affordable quality healthcare? What role can technology be playing? With that in mind, we decided to include artificial intelligence and biotechnology. Soon, within a month, we realized the arrival of COVID-19 virus. The virus did not ask for visa, immigration papers. It traveled around the world. Authorities had to find an effective solution to face the virus. Researchers, scientists, industrial entrepreneurs, under the guidance of various governments, came to seek solution for this virus. Friends, normally it takes about 8 to 9 years from the concept, from the research labs, from glass beakers, to reach the marketplace on the shelves of Shoppers Drug Mart and pharmacies. Here we saw within a year, under the able guidance of governments around the world, we got to get the vaccine solution from be it Oxford University or National Lab in Pune, India, to the marketplace, from Harvard, the lab in Germany. We had AstraZeneca, Bharat Biotech, Pfizer, or Moderna bringing vaccine to the marketplace. It all happened when the knowledge workers came together with entrepreneurs, industries, and under the able guidance of governments. What it recognizes is how important human healthcare is. The capital invested on on citizens, how important it is. We all talk about Davos Economic Forum, talking about opportunities for enhanced growth, industrial production, investment. What the COVID has underlined and confirmed is how important it is for us to invest in healthcare and human capital. We saw that in the earlier healthcare conference in Delhi, a senior leader from India and a healthcare service provider, Dr. Peeta Reddy, asked us how Canada and India can be working together to bring affordable, effective solutions. The two democracies, what can we be doing together? Canada with its universal healthcare, with great investment in universities and research institutions, and India with its demographic advantage, it is the pharma hub for the world, and of course, its leadership on the digital technology. Here is a natural potential partnership for the two great countries to be working together to help the whole global population. It was said earlier when late President Kalam visited Canada, he obviously recognized, speaking to the leaders of Canadian governments, how Canada and India, the two democracies, can be working together for the benefit of the global population on energy and renewable energy. The same is true in healthcare for helping the human capital. How the two democracies can be working together. So in this conference, we the partners with the government and the industry, FICCI, and universities to come together. We have more than 60 60 eminent speakers representing industry, senior government officials, and industry leaders coming together and sharing their thoughts, sharing their vision, how we can be working together to address the challenge that we face on healthcare. We are proud to say this conference not alone brings together the eminent speakers from industry, government, and universities, but also we are proud to say, as representing the civil society in the knowledge economy, how important it is to invest on research, innovation, and of course, focus on youth, our tomorrow's leaders. Recognizing this, Canada India Foundation, on its share representing the civil society, will be awarding 6 awards during this conference for young, innovative entrepreneurs that will be announced tomorrow. Not alone that, the civil society, Canada India Foundation, is coming together with University Health Network Toronto, rated as number 4 in the world and best in Canada, looking at integrated healthcare services, focusing on diabetes, kidney, cancer, how we can be working together, investing on youth to work under the able guidance of professors at the University of Toronto. So we will be announcing tomorrow during the conference. Not alone that this conference brings eminent speakers to discuss on healthcare, giving awards to youth entrepreneurs, announcing the endowment, but also we'll be focusing how the research, the deliberation during the conference can be put together as white paper, and we will be submitting it to our both governments, national governments, be it in Canada as well as in India, for their kind of reviewing of our deliberations and including in their future planning to serve the citizens of the country. Friends, we live not in the political jurisdictions, we live in the global village. Anything that we do should benefit the citizens of the world, and recognizing that Canada India Foundation, as part of the civil society, is doing its bit, is doing its share, together working with government agencies and industry leaders, and of course, university academic leaders. It has been a great opportunity and privilege for us in Canada India Foundation that we continue the journey working together, serving the community, the global village, the global community. With that said, I now request our Consul General, Srimati Apurva Srivastava ji, to share her thoughts. Apurva ji, thank you.
Thank you, Lucky Bhai. Namaskar and a warm welcome to all the participants of the 3rd Canada-India Health Summit, Healthcare Summit 2021. I would begin by thanking Canada-India Foundation, University Health Network, and FICCI for putting together this power-packed program. This is the 3rd summit, but this time around it's different in many ways, coming as it in the backdrop of this devastating pandemic. This is the timing of the summit is very important, because it will not only create synergies between our two countries for addressing some of the pressing challenges that our healthcare systems are facing these uncertain times. I would like to convey my deepest gratitude to Dr. Lakshmanan, Dr. Chokalingam, Satish ji, Mr. Uday Shankar, and Dr. Kevin Smith, and all the experts for the immense contribution in formalizing the summit. We at the consulate are really honored to be part of this great initiative. There's this pandemic has no doubt strained even the best healthcare systems in the world, and there's no doubt that healthcare systems need to be upgraded in terms of robust and augmented infrastructure, resilient supply chains, modern diagnostic tools, and skilled manpowers of doctors, nurses, and caregivers. There's also a need to address the gap in data assets and integrated systems, and tap into new and innovative technologies for curating an effective pandemic response. In this context, I'm really happy to note that so many thought leaders, policymakers, entrepreneurs, civil society participating in this program. And this summit is expected to produce a well-defined blueprint giving policy recommendations to both Canadian and Indian government. And I'm sure it will be taken cognizance of, and many things would be implemented. The pandemic response can be found only through joint collaboration and sharing and exchanging of best practices, technologies, and innovations. And as strategic partners, India and Canada have already demonstrated that how it works on the ground. While India used its production capacity to provide the vaccines to Canada when it needed them the most, and Canada has now come forward on its own to support India in its fight against the second wave of coronavirus, which has ravaged the country, which has affected the country recently. Given India's vast expertise in healthcare, including in state-of-art production capacities, and Canada's highly developed technology and innovation healthcare innovative ecosystem, India and Canada are natural partners. I hope that the summit will stimulate fresh ideas, create collaborative opportunities, and sharing of best practices that can be effectively implemented to address the contemporary challenge. I look forward to hearing insights and recommendations of health industry professionals and leaders, and how India and Canada can work together to avail this opportunity and address this unprecedented challenge. As we know, Canada is home to one of the largest South Asian community. We have more than 1.6 million Indo-Canadians living here. Indian students form the largest chunk of international students. We have more than 230,000 Indian students. Plus, there are 700,000 Indians living and working in Canada. This highly skilled Indian professionals lend a competitive edge to Canadian business, including the healthcare sector. We already have a number of Indian pharma companies who are present here in Canada. Some Dr. Reddy's Lab, Accor, Natco, Oro, Dupin, and many others all are providing affordable pharma and healthcare products to Canadian citizens. Given India's role as pharmacy of the world, as well as the largest vaccine producer, I'm aware of the great interest in Canada for further expanding this mutually beneficial collaboration in healthcare sector. Since B2B meetings between Canadian and Indian enterprises are also part of this summit, I'm sure this will lead to a number of collaborations in business, academic, and government health sector. I'm also very happy to note this power play pitch competition, which is held to recognize and reward innovations in healthcare. There were three pre-summit events also were organized, which led up to the summit. There's also this research fund which is coming up. So I think this summit is a wholesome summit, and we hope. I'm confident that the insights and recommendations from the summit will propel India-Canada healthcare partnership to great height. Thank you once again for making us the part of it, and have a great session. Thank you.
Thank you very much, Apurvaji. Your support, inspiration, and guidance in organizing this conference is highly appreciated. We from Canada India Foundation, thank you for all your support and help. I now, on your behalf, will request Shri Uday Shankar, President of FICCI, to come and share his thoughts. Mr. Uday Shankar ji, I want to thank on behalf of the organizing committee and Canada India Foundation, all the wonderful help that we received from your colleagues from FICCI. It has been great inspiration for us, getting us to the Indian audience. You have been very, very helpful working with the Indian industries. We look forward to working with you for many more summits and conferences. Canada India Foundation and we Canadians can be working together with FICCI, you forming the bridge for us from Canada to India. Thank you very much, Mr. Uday Shankar. Request you to kindly share your thoughts, Mr. Uday Shankar.
Thank you, Dr. Lakshmanan. Ms. Apurva Srivastav, the Honorable Consul General of India in Toronto, Dr. Kevin Smith, Mr. Satish Tucker, Dr. Chokalingam. I am delighted to welcome you all at the Canada-India Healthcare Summit 2021, a joint initiative of Canada-India Foundation, Consulate General of India, and University Health Network, Toronto Rehab Institute. Federation of Indian Chambers of Commerce and Industry, that is FICCI, is privileged to support this summit and lead the virtual Indian delegation to share insights and experiences and explore solutions for better healthcare provisions in both countries. Canada is home to one of the largest Indian diasporas in the world, and we value the depth of the bilateral relationship between the two great countries. This relationship is built on a shared commitment to democracy, pluralism, and people-to-people ties. Canada and India have been undertaking bilateral negotiations towards a comprehensive economic partnership agreement and a foreign investment promotion and protection agreement in various sectors, whether it is nuclear cooperation, science and technology, agriculture, civil aviation, energy, etc. However, we feel that we have great potential for collaboration in the healthcare sector. Being a global leader in universal healthcare, Canada's strengths lie in providing quality healthcare to its people. India, on the other hand, has done a great deal over the last decades to provide basic and quality healthcare to its population. While Canada spends more on healthcare than most of its peers, India over the years has scaled new heights in providing healthcare, whether it was effectively wiping out polio, reducing maternal and child mortality, or setting up world-class secondary and tertiary healthcare facilities. A major achievement for India towards universal affordable healthcare is the launch of Ayushman Bharat, the world's largest health insurance as well as comprehensive care program. But the current pandemic has put the spotlight on the task of building and transforming the Indian healthcare infrastructure. COVID-19 has further enhanced the scope of cooperation between the two countries by bringing an era of a paradigm shift in the realm of diplomacy, with healthcare and medical diplomacy taking center stage. And I think that this is a unique opportunity between the two countries. It is heartening to see that Canada is sending medical supplies in an effort to support India's COVID-19 response, as the country faces a devastating second wave that has overwhelmed our healthcare system. On the other hand, India, as one of the largest suppliers into the COVAX program, has supplied COVID vaccines to Canada, among other countries, despite its own shortages. COVID-19 has also highlighted the importance of keeping patients, families, caregivers informed and connected for building the future healthcare delivery. Healthcare organizations have been forced to refocus and adapt in various ways that will help enhance patient centricity and hence the outcomes through the use of empowering technologies like AI, Internet of Medical Things, and big data. During this pandemic, India has witnessed an exponential growth in digital innovations, and the timeline for digital adoption has been compressed from 5 years to 8 weeks. As India emerges as the world leader in digital technologies, we look forward to collaborations in upgrading our research and knowledge, strengthening and upskilling our healthcare workforce, as well as augment our healthcare infrastructure through technology that will define the post-pandemic healthcare almost everywhere in the world. Going further, the future trajectory of mutual relations will be defined by how countries across the world navigate this unprecedented pandemic. Together, India and Canada can plan ahead for the massive rebuilding effort that will be required to recover from this pandemic globally, not only for the two countries. But when I say this, it applies to supporting the low and other middle-income countries everywhere in the world. FICCI looks forward to continued collaboration with Canada-India Foundation on future endeavors to help Canada and India achieve great economic growth while creating healthy and empowered human capital. I believe that this is an unprecedented opportunity for the healthcare community and healthcare businesses in the two countries, not only to create great value for themselves and the two countries, but for the rest of the humanity all over the world. FICCI is delighted and privileged to be a partner in this great event. Thank you very much.
Thank you, Uday Shankarji, for that very kind words and a very collaborative and cooperative sense. I think that's phenomenal, and thanks to FICCI for your kind support throughout to mount this conference. My name is Arun Chokalingam. I am the chair of the Scientific and Technical Committee. I just want to let you know, of the 450 people who have joined this event, nearly 2/3 are from India. I think that shows the level of interest and commitment from the scientists and people from India. Now, without any further ado, let me introduce the next speaker, who is another partner, the University Health Network, and especially the Toronto Rehab Institute, who have been working with us very closely for the last 9 months in putting this conference together. We will have the video recorder tape of Dr. Kevin Smith, who is the CEO of UHN.
Hello, my name is Dr. Kevin Smith, and I'm the President and CEO of the University Health Network in Toronto. Welcome to the Canada-India Healthcare Summit, which brings together some of the world's leading experts in healthcare, research, business, industry, and academia. I want to start by acknowledging what's happening in India and offer you our heartfelt sympathy as well as our full support as you work through the challenges of COVID. The devastating loss of life is unimaginable, and we salute all that you are doing to try to bring this deadly disease under control. On behalf of UHN, I hope you'll accept our deepest sympathy for the losses you felt and our deepest admiration for your innovation in trying to respond to a once-in-a-lifetime crisis. The terrible news, though, also reminds us why we're here today and for the next couple of days, and that is to create a better, healthier world. Over the next 2 days, you'll have the opportunity to focus on solving problems of global health crises. And I can't think of a better time for this group to focus on anything but that. I hope you will have a rewarding summit experience, and I look forward to hearing your ideas about COVID and how we can improve our response to COVID and similar diseases in the future. I want to say a very special thanks to our hosts for making the summit possible, and they include the Canada-India Foundation, UHN's CIHS Institute for Research, the UHN Foundation, which supports our work as Canada's top research hospital, the Federation of Indian Chapters of Commerce and Industry, and of course, the Consulate General of India. I wish you a wonderful meeting and thank you for your participation.
Thank you very much, Dr. Kevin Smith. It's my pleasure now to invite Mr. Satish Thakur, our chairman of Canada-India Foundation, an energetic leader for all that he does for our community and for the country, Canada. I now request Satish to share his thoughts. Mr. Satish Thakur, chairman of Canada-India Foundation.
Namaste. Thank you so very much, Dr. Lakshmanan, and a very good morning, friends from Canada, India, and other parts of the world. As a chair of Canada-India Foundation, I'm extremely delighted to welcome you all to this inaugural session of Canada-India Healthcare Summit 2021. You have all come together on this virtual platform from different geographical locations and time zones with one single purpose: to advance science in the time of COVID-19 so that we can overcome the virus, while developing tools and techniques to prevent a recurrence of another disease like this. CIHS 2021 is the result of a dedicated team of visionaries, professionals, and volunteers who have been working for months to make this event possible. For Canada-India Foundation, CIHS represent a continuation of a journey that was inspired and led by Dr. V.I. Lakshmanan, who originally conceived the idea of Canada-India forums in 2009 and chaired 2 previous healthcare summits, as well as forums on different sectors of mutual interest. We are also thankful to have a healthcare leader of international repute in Dr. Arun Chokalingam, who has been instrumental in putting together the gathering of expert speakers you will hear from in next 2 days. The 2 of them have been backed by many professionals and young volunteers who have made this summit possible. CIHS 2021 owes its implementation to the commitment and support extended by our partners, the Consulate General of India, Toronto, Shrimati Apurva Srivastava-ji, UHN, FICCI from India. We heard very inspiring remarks from Mr. Uday Shankar-ji. Thank you all for your support. And in the next 2 days, we'll see dozens of domain experts from Canada and India presenting their paper on how biotech and AI has been employed in fight against pandemic. Innovations in these 2 areas have led to the quick development of vaccines and, more importantly, its introduction and adoption among general population. The summit, through the words of the expert speakers, will reveal how much more innovation is coming up in these two areas. Represented here are the leaders from almost all spheres of healthcare: scientists, technologists, health practitioners, public health officials, honorable ministers from Canada and India, policymakers, healthcare industry entrepreneurs, and executives from the leading vaccine developers. We thank each and every one of you for your participation. Canada and India have so much to offer to the world, especially in the healthcare and related human capital. As is evident here, some of the best minds in these two areas are from our two countries. I hope that the ties that bind us and the knowledge we share during such meetings will result in positive outcomes, not just for our two countries, but also the whole world. We in the CIF are doing our modest bit in this journey to better healthcare. As Dr. Lakshmanan mentioned, for the first time at CIF, we are honoring young, innovative healthcare entrepreneurs with the CIF Canada-India Healthcare Innovation Awards. We are also partnering with University Health Network and Toronto Rehab in an exciting initiative to advance evidence-based research on holistic integrated medicine by combining the principles of traditional medicine like Ayurveda and current practices of modern medicine in the area of chronic disease like diabetes, kidney, heart disease, and cancer, and to tackle post-COVID rehabilitation program. The announcement with the full detail will be made at the end of the summit tomorrow. Be ready for a great surprise. Thank you all, and wishing all a very enlightening summit ahead. Before we begin the proceeding further, let us observe a minute of silence in the memory of many millions of people all around the world who succumbed to the deadly virus, and many millions more who were afflicted by it.
Thank you very much, Satish Ji, for your deliberations. Friends, as the chairman, I take the privilege on letting you know that we all live in the global village. A true Canadian born in Canada, after working in many parts of the healthcare world, today has joined to work with Dr. Prasad in Reddy Lab in Hyderabad. Another great Canadian born in Canada is working on the healthcare sector in San Francisco. It only tells you how important it is to share our knowledge, our experience, and also working together on this area of healthcare. Sarvo Janaha Sukhino Bhavantu. Saying that, we will close this session and look forward to starting the next session, the keynote session that will start soon. Thank you very much. Thanks for joining. God bless. Thank you.